Then the communication. A good doctor is not always a good communicator. So you need to know the communication also. The skills of communication to a patient, to his attenders. How to break a bad news. For example, a patient has lost his life. Just going and telling him your patient is dead. That is not something which should be taken seriously. So there are ways which we can teach them, and these things also are inculcated in our curriculum. So there's all these things are falling in line and which we are going to follow. That's going to be the future career for our doctors.
Thanks a lot, Doctor, for that wonderful answer. Next question is directed to Dr. Aditya. The question is, many young students hesitate to pursue medicine due to concerns about burnout and mental health. What strategies can help mitigate this intense pressure associated with this career?
Thank you. I think, again, this is a really important question, this concern about burnout and mental health. Now, I'm hoping that as students, young students, you're all aware of your mental health and you will get better, and I'm assuming TISB, like many schools, is also incorporating some mental wellness programs as part of its curriculum. So you're already going to be more aware of your mental health. There are certain mental health conditions. So I work a lot with students, and I'm a psychiatrist at the National Law School of India, and lots of universities like this. And one of the things that I also teach in 2 universities in the UK, including Edinburgh University. And there, what we're focusing on is, if you do have mental health problems currently, is medicine a good program for you? And the answer is, a lot of my colleagues in the UK, for example, have had mental health problems and have become fantastic doctors. And I want you to remember is that actually having mental health issues are not going to preclude you from being a doctor, nor should you worry that being a doctor will cause certain kinds of mental health issues. The question of burnout is really interesting. A lot of you very young people are talking about burnout. Burnout is something that used to be discussed by many older people, but not by people at 14, 15. I think burnout is more likely to happen in several situations. One, I think hospitals and medical schools have to get more friendly and more, I think, gentle in their approach in education, and my colleagues have already outlined that there's been lots of changes in medical education. The other thing that I would urge very, very strongly is to think about why you want to be a doctor, and only to be a doctor because you want to be. Not because your biology scores are high, not because you scored really well, or because your mom and dad wanted to be a doctor but couldn't, and they'd love you for you to be a doctor. That's no reason to be a doctor. It is a reason to be a doctor. I think some of us may actually have been in that position, but it's not a good reason to be a doctor. I think I can think of few worse things than being a doctor if you didn't want to be one. Medical education is tough. No matter how much technology is going to come, how much we change our medical education, you're still going to be expected to learn a lot, and the learning should be fun. And maybe as a society we must change to making learning less frightening, to making our exams less brutal. So we did a research program recently at NIMHANS, which is, are exams traumatic? And interestingly, my team interviewed 500 adults who came to NIMHANS, and 380 described a lifetime history of PTSD associated with a professional exam like MBBS or an MD. That tells me that our exams are themselves overly brutal and need to be adjusted. So I'm not a fan of conventional education. I'm not a fan of exams. I think exams are awful ways to assess young people and young minds. I think exams are a cheap and horrible way to understanding intelligence. But you are going to be, at your age, you're not going to be able to dodge the exams that are set ahead of you. But enter these exams with the right spirit. Do something that really interests you. Life is relatively short, and there's far more important things than being a doctor. So if you want to help people by being a teacher, be a teacher. If you want to help people by being an IAS officer, go for it. Being a doctor is not special. Yes, it is true, we enjoy a lot of respect in our field. But there's a lot of good ways of getting respect in other fields as well. So if you want to be a doctor, be a doctor. Don't worry about the burnout, because if you really enjoy learning, then there's no question of burnout. Every day is fun. My colleagues may back me up on me. I never get bored at work when I'm seeing patients. Every day is an extraordinary series of stories and people, and they're always teaching me stuff. I'm always learning stuff. It's fun. That's how I'm hoping that if you become doctors, that's how your career will turn out. Thank you.
Thanks a lot, Doctor, for your answer. Also, students will be having question and answer session after the four topics are over and the 4 question and answer sessions are over.
Yeah. Thank you so much. I definitely agree that a lot of us don't really like exams, and it feels good to see someone from a very experienced profession as yourself agree with us there. To Dr. Nagesh, AI has already outperformed human doctors in certain diagnostic tasks. Will we see a future where AI completely replaces physicians in certain fields?
And earlier we were discussing any other role for a doctor. Let's begin there again. You know, basic medicine is the first degree. Unlike any other industry, you need a manager, you need a CEO, you need a CFO, you need a scientist, you need, even this medicine specialty has all the arms. And if you are a basic doctor and get into these specialties, it's more helpful to manage one of these. Number one, you can be and this is the only profession where you can be a philanthropist by working every day. Coming to AI just can't drop down from heaven down to earth. At the end of the day, as I mentioned, it's an armamentarium, and we need a doctor to interpret that, confirm that. For example, in radiology, where a lot of scans are fed into the system, and that helps me to do the diagnosis precisely. Earlier, the first thing comes is clinical examination of a patient, then comes his investigation, then comes his interpretation of the investigation, then you treat the patient. In the interpretation quarter, if you have AI assisting you, for example, in pathology, in your clinic, in your blood examination, in your investigations, we have more precise diagnosis. The human error is taken care. And as Dr. Ravi mentioned, in the technology of the equipments and the management, I think AI is going to help, but then at the end of the day, to evaluate AI, to assess AI, and to utilize AI, you need a basic doctor. That's not going to go away.
Thank you so much. So a running motive seems to be that we can use AI to help our medicine, but it will definitely not replace us. So for all of you here, medicine is definitely the place to go for AI users. So can we have, to Dr. Darshan, bias in AI models is definitely a growing concern, especially in medical diagnostics. How can we ensure that AI-driven healthcare is fair and reliable for all populations?
First of all, we have to remember that we are not born with AI. We're born with our natural intelligence. AI has come after that. AI has been created by human beings. Now, it needs to be trained. AI also needs to be trained. Okay? So whatever input is being given to the development of artificial intelligence, based on that, its output is going to come. Now, if you are not going to train it correctly, the output is not going to come correctly. So there have been a lot of instances wherein AI has been seen to show some selection bias. This has been even studied in the West, for example, in the sense that whatever input was given to the AI, it did not interpret it properly. So the information that was provided by the AI itself was wrong. So these sort of bias comes in the diagnosis, especially in the medical diagnostics. Rather than the clinical diagnosis, the paramedical or the technical aspects of it, that is where the bias comes in the AI. Now, how to ensure that it is fair? The person who is taking care of it has to be fair. Now, if that is not going to happen, AI is going to be falsely giving us information. It is going to falsely make us make decisions, and that is going to be counterproductive. To make sure that that is going to be fair and more helpful for us rather than harmful, the way that it is being created and the way it is going to be used and the way it is going to be analyzed, that needs to be taken care of. And if that can be done, then AI is definitely going to be most helpful. Otherwise, it is going to be a false promise, and a very big false promise. So it should not be over-dependence on it. We need to have a human element to it. We are treating human patients, and probably we shouldn't even be calling them just patients, calling them as human beings. The human beings, they have come to us for help, and you're taking the help of the technology to make sure that you help them better. That's why AI should come into picture. It should not be a selection bias. In fact, to give an example, I was just going through, in America, I think there was a imaging thing which was used, the CT and MRI, and there was some input given to the AI. It was dividing the information based on whether it was for white people or for the black people. Is that the way we should be treating our human beings? Based on what complexion they have? That is not the way it should be. It shouldn't even be. The data collection should not be like that. Forget about the analysis and the interpretation. So if these sort of things come into the practice, it's unhealthy. Basically, it is unhealthy. So the input given to the AI should be very important. And like I said, the person behind it, who has created it, and the person who is going to read it, analyze it, interpret, and make use of it. They just need to use a natural intelligence so that it can be put to the best use.
I think I agree with him. Health is not just coding. Health is basically based on empathy. Empathy cannot come with AI. AI is definitely going to be very useful tool, very useful armamentarium, provided it's used properly, as Darshan said. It can't replace empathy. I think doctors are going to stay.
Just like that, one more point, and what we have to keep in mind, especially for the young people, is what is the literal meaning of doctor? It has come from the word to doctor, doctrine, if you just recollect the words. It's basically to teach. It is not it doesn't literally mean to heal. It means to teach, if you go into the literal meaning of the word. Okay? So to teach and to heal are part and parcel of the profession. And to do that in the best manner, we need to make sure that whatever tools that we have should be used properly. And AI is one of the tools. It is not a replacement. We have to keep that in mind.
It seems that we have a general consensus that there should not be any over-reliance on AI. And it also seems that the biases that exist in AI sort of replicate our human evolution, like if we go backward another 50 years where racial discrimination was more prominent. So thank you for that.
Just a minute, I'll just give you an example to add on that. For example, how your AI or your internet works. You go to your Google, you tell, I've got headache. Google gives you 100 causes of headache. Are all of them there in you? No. And it ultimately, the human beings and doctors who are going to decide. It can occur due to your stress, it can be due to fever, it can be due to so many things, maybe. Or even a pain abdomen, whatever it is. We do come across people, doctor, I've got a headache, should I get an MRI done? Should I get a CT done? Because it shows I've got a brain tumor. So not everyone with headache will have a brain tumor. So you have to be careful. It will give the answers, we have to choose what exactly is it.
I'll have to admit that even I'm particularly guilty of Googling my symptoms online. So
There is a idiot syndrome. I hope you know about it.
Okay, I'll definitely research on that. I'm not sure of it. To Dr. Ravi, telemedicine and AI-driven consultations are becoming more common. Can virtual healthcare ever truly replace, for example, in-person doctor visits?
Yeah, telemedicine and AI-driven consultants. AI, they've already told you. There are advantages, there are disadvantages of AI. Telemedicine, of course, it is there to stay. It will be very useful, particularly in certain situations when you can make use of this telemedicine. Telemedicine is like something, you are in a remote place, for example, a faraway place where there is no access to the consultants, the specialists who are there. So the doctor who is working over there, if he is not experienced, but he's got everything, this situation, the atmosphere for treating a patient, sometimes he has got no complete understanding of that. He can always come on to the specialist. So telemedicine will definitely help in the patient care, in the research what you want to do, or in the diagnostics of a patient. Particularly, this did a wonderful job during our COVID telemedicine. We were part of this COVID treatment. For example, COVID, as you all know, it affected everyone. And people were being managed in intensive cares, ICUs. Many of the remote places had ICUs or intensive cares, but not all of them are trained to manage these intensive cares or ventilator. For example, I might be a physician, but I am not a specialist in managing the ventilated care units. In such situations, you have this facility for telemedicine, facility in the remote place, to contact people who are specialists. You have a hub and spoke model, a center is there, and people come online from various centers in the periphery. They contact us one particular time, they sit, they talk about their problems, that each individual rounds is done. Telemedicine rounds itself can be done. So they go to a patient itself, they discuss that particular doctor over there, he discusses his problem of that patient with a specialist over here, and he can solve his problem. So definitely telemedicine as well as it will help you in improving the patient care in the diagnostics and all. AI, I think we have discussed anything adequately about AI. So telemedicine, yes, definitely it will help you in patient care.
Okay, thank you. Especially, I guess, in rural areas where healthcare is a lot more inaccessible. I think a really good example of this would also be during COVID-19, when the government unleashed a program for the BBFP Health Service line, which I actually got to see, and it was so incredible to see so many people who weren't able to get to a doctor during the pandemic were able to finally get health service, healthcare online. I think it marked a complete change in the healthcare system in India so far. So that was one good thing we got out of that. To Ms. Lalita, with AI-driven precision medicine and gene editing on the rise, should medical students be required to learn coding and computational biology alongside traditional medicine studies?
Maybe yes, but with the given curriculum, it may be tough for MBBS students. But of course, having known that, or it can be a career itself. I think MBBS will be a basic thing, and these are the future options for our students or medical graduates also. Not only as a treating physician, if they are learning parallelly these things, they can be much more, and AI will make more sense. If doctors start learning this and trying to implement, will make more sense. And now most of the times it's usually developed by some non-medicals who do not understand what are the implications. Probably a medical graduate who learns this as an additional qualification or something can enhance the implementation, and they'll be in a better position to validate it and put it into use, and which will make much more meaningful because they'll understand what is required and what is not required. And definitely this will be a career by itself for the medical graduates also, who has additional AI skills sets. As a separate skills, it has to be added as an added advantage, I think, if it is there.
Okay, thank you. So the idea is that specialists should specialize, and this would be great, especially if people don't want to pursue their MS. This would be another career for them, is what you're saying. That's great. To Dr. Aditya, AI-powered mental health chatbots are being used to provide therapy and crisis support. This is in reference to Dr. Ravi's point as well. Can AI effectively handle any form of mental health care, especially when it's trained?
Any form? No, but there's lots of good work going on. There's lots of exciting stuff. And I think we overuse the term AI because most of what we are calling AI is actually machine learning. And machine learning has already been fantastic in medicine for things like retinal scans, for example, or mammography, for understanding mammography. And I think we're getting to the point where machine learning is superior to the human eye in recognizing early signs of cancer and serious illness in some pathology samples, for example. But with this question of mental health, so we're already using, so I keep subscribing to all the new LLMs, and for example, the 4.0 ChatGPT, for example, has a therapist, an AI therapist on it. And every other week, I'm asking it the same questions to see how it's evolving, and it's actually quite good. We're getting to the point where the AI therapist is close to, not quite there, to my entry-level therapist that I'm training. And I'm very excited by it. But it doesn't, and I think in the future, for example, some jobs in mental health will be replaced by AI bots and AI engines. I don't think that's a bad thing. I don't necessarily think that's a bad thing. But as we were talking about the human input into understanding, the thing that I think most of you will have to learn is understanding how AI actually gets information. So the word used in AI technology is hallucinate. Are you all familiar with the word hallucinate? Hallucinate is a very psychiatric word, but it is now being used in technology to see how does information get picked out of the ether and sent to you on your phone. Most of you, yesterday I was doing an interview with 20 psychologists to say I was asking them about a diagnosis, and I asked them all to Google it so that they can tell me the answer, and they all used their AI engines, but they did not know where the AI engines had got the information from. This is the sort of stuff that you guys are going to get how smart at, which is where is the information being mined from? What is the validity and the safety of that information? And when information is being presented to you through AI, how are you going to do this? So in mental health, we're already doing lots of interesting stuff. So one of the research projects I'm involved in is using watches to develop what is called a digital phenotype of mental health. So when I have people with bipolar disorder, the biggest risk that they have is when they start becoming manic, they can't spot it, their family members can't spot it, and by the time the mania becomes very severe, they've lost their job because they have no judgment and they're in danger. We're trying to pick up early warning signs of mania using things like a digital phenotype, using a watch, which is what happens to their heart rate, their movement phenotype, all of these change. So I'm really excited that the AI will eventually grow to supplement a lot of the mental health work we are doing. It is going to replace some entry-level stuff, and I think in the future, many of you are going to get therapy through your phones and probably by engines on your phones, and having humans assist it, maybe remotely, maybe through your own therapist saying, why don't you do this program on your phone and I will speak to you tomorrow, is going to be a thing of not next 10 years, but in the next 6 months. So I'm really excited about it. I think AI is going to have a lot to offer mental health, and looking forward to it.
Absolutely, thank you so much. I'm glad to see that you're a pioneer in the usage of AI ethically. But it's also great to see that things where other factors like family fail to diagnose, for example, bipolar disorder, AI can prove a way to do that. And so it's about using it effectively and in due accordance with that. Yeah. So moving on to lifestyle diseases among teenagers.
So, my first question is, why are we seeing an increase in type 2 diabetes, hypertension, as well as cardiovascular diseases in today's age? And this question is directed to Dr. Ravi.
Well, I think you all will know the answer probably for this. Why are we seeing an increase in diabetes? Basically, these things, diabetes, hypertension, cardiovascular disease, are all grouped into what are called as non-communicable disease. They're a group of disease which often linked to our lifestyle. It doesn't always mean that lifestyle is the factor. You might ask a candidate or a student who is 20-year-old who is teetotaler, athletic, but he still develops diabetes. Yes, the first thing is probably one is the genetics, which is there. Number two, the early diagnostics, which we are probably into nowadays. Of course, all this is contributed by our lifestyle modification. We need a lot of lifestyle modification, the changing scenario among the teenagers, which we are seeing. Inactivity is one thing. Probably I might not say that in this school, probably you have a beautiful campus of a field and everything. So inactivity is one thing. Screen. We are addicted to our phones. Children are addicted to their laptops. COVID made them more addictive to their online classes. There is no interaction. Then the food habits which are there, which add increase to this prevalence. The prevalence of diabetes is somewhere around 10 to 11% nowadays. So all these factors like genetic factors, inactivity, addictions, and pressures added by your peer pressure, parental pressures, teachers' pressures can all lead to your increase in the prevalence of these diseases. The lifestyle which we talk about definitely plays a very, very important role in the development of all these diseases, non-communicable disease. Inactivity, food, which we are all used to, junk food or fast food. Fast food is not fast. I call it fast food is fat food. You take out the S, it is a fat food. So definitely we all see children using this and going on to develop obesity in children itself. This obesity can in turn lead to the development of your non-communicable disease like diabetes, hypertension. Development of these diabetes, hypertension itself are risk factors for development of cardiovascular disease.